Well, good morning, everyone, and welcome to today's webinar on Medicare 101. I'm your moderator, Amanda McLean, the Farm Management Specialist here with North Dakota Farmers Union. A few housekeeping tips before we get started. This webinar is being recorded, so everybody is on mute for the time being. If you would like to rewatch this or share it with others, it will be on the North Dakota Farmers Union YouTube channel. At the end of the presentation, Lance, we will open it up for Q&A, but at any time, feel free to type a question into the chat and we will have Lance answer those at the end. So with that, I would like to introduce Lance Boyer, who is our Sales Director of Financial Products at Farmers Union Insurance. Lance brings a wealth of knowledge, having worked in the Medicare and health insurance business since 1990. He has been with North Dakota Farmers Union since 2012. Lance resides and works in Bismarck. He lives with his wife Lori and their three kids, Gracie, Ava, and Caden, and their two furry kids, Piper and Bo. With that, I will turn it over to you, Lance.
Hey, good morning, everybody. Yep, you can tell by all this gray hair, I've been in the Medicare business for a long time. And the one thing I found in all these years is that Medicare is always changing. It's literally become a maze of options and plans that you have to sift through on a yearly basis. The good news for Farmers Union folks is we have an entire team of specialists that you can lean on through your local agent that can guide you through this maze that's Medicare and make sure that you have the right plans for you. So with that, I just want to do kind of a basic Medicare 101. I'm a conversational type person, so I don't want to wait till the end and say, well, we'll take all the questions in. If you have something, please type it in, or because I believe everyone's on mute, so just put it in the chat box and we'll absolutely take questions as they come. So all right, some basics of Medicare. Folks who are 65 and over are eligible for their A and B of Medicare. Folks under 65 with certain disabilities, and then also people that have ESRD qualify for Medicare. Enrollment, they use the term automatic. It's when you sign up for your Social Security benefits, they'll automatically trigger your Part B of Medicare. You receive your Part A upon your birthday, so they automatically enroll you. It's a passive enrollment and an active disenrollment. If you don't want to take your Medicare at that time or your Social Security, you have to reach out and we can assist with that if you don't want to take it. Some folks do delay it if they're getting coverage through work. They'll delay their coverage, and as long as you have what's called credible coverage, you do not incur any penalty for delaying your Part B. And I see we've got some Farmers Union folks attending today. Our plan does have credible coverage, so if you were covered under our employer plan, you would have credible coverage. You would not incur a penalty for delaying your Medicare enrollment. So the ABCs of Medicare, Medicare Part A is hospitalization, inpatient. So when you think of receiving your Part A coverage, anything on an inpatient basis, home health care, skilled nursing facility care, all of that is triggered through your Part A. So it's comprised of a couple different pieces, with A being your hospitalization policy, and then B is your medical policy. Part A is considered free, even though you've paid for it. As long as you have 40 or more working quarters, you or your spouse, and you've paid taxes through an employer payroll deduction or self-employed, your Part A is fully paid for when you go on the Medicare. Part B is your medical care. Most services fall under your Part B of Medicare. Your outpatient care, your preventative services, your doctor's visits, diagnostic and therapy, durable medical, as well as ambulance services. So the bulk of what folks do today is most things are outpatient based, falls under your Part B coverage. Part B, you do pay for when you go on to Medicare. What's considered the standard monthly premium for 2025 is going to be $174.70. But they do bracket it by income, and if they call it IRMA, which is an income-related monthly adjustment amount. So depending on where you fall income-wise, you could pay the standard premium, or you could pay a higher amount. So if you look at the chart, a married couple filing a joint tax return, if they were to make above $322,000, but not more than $386,000, their Part B premium jumps up to $454.20. So if you fall in this category when you meet with your agent, they'll let you know that up front so that you can plan accordingly with your plan choices and understand what your total Medicare costs will be when you enroll in Medicare as well as a health plan. So when are we eligible to get this Medicare? Your initial enrollment period happens 3 months before the month of and 3 months following your 65th birthday. So you have a 7-month window to make that initial election period onto Medicare. We highly encourage getting a hold of your agent at that 3-month before mark so that you can get the benefits you're entitled to start right away instead of past the time in that second window of 3 months after the birthday. There is also what are called special enrollment periods, SEPs. Those trigger your enrollment into Medicare. One of the biggies is loss of credible coverage. If you lose your employer coverage, that triggers an eligibility for special enrollment. And then if you happen to miss your initial election period and you do not qualify for a special enrollment period, you then would be eligible under what's called the general enrollment period. And that runs January 1st through March 31st of each year, with your effective date being the 1st of next month. So if you enrolled in January, your Medicare would start in February. If you weren't able to enroll until March, your Medicare then would not become effective until April. And if you do end up as a late enrollee without qualifying credible coverage, your late enrollment penalty is 10% of the standard premium, which was at $174. So your late fee would essentially be close to $18 a month. It is for the life, as long as you're on Medicare, that penalty doesn't go away. So even though it doesn't seem like a lot of money, it surely adds up over time. So that's why we encourage folks to get out in front of this. Now, if you do happen to have a higher income and you fall in one of those categories where you pay more than the standard rate, they don't base the penalty on that. It's just based on the standard rate. So, but let's avoid that. Let's reach out to your agent beforehand and make sure that you don't incur any penalties. What does it look like when you're covered under Part A of Medicare? Your first day of hospitalization, you have a deductible that is currently $1,632. That deductible is good whether you're in the hospital for 1 day or 60 days. That deductible does adjust for inflation and does go up every year. So as we go through this, you're going to see the need for enrolling in a Medicare health plan to go alongside of your Medicare, so that you don't absorb these costs. Skilled nursing care, the first 20 days are covered by Medicare, and then they do a daily copayment on days 21 through 100 of $204 per day. Just an FYI, most people never trigger the Medicare requirements for skilled nursing, the skilled nursing benefit. So please talk to your agent about other ways to cover the cost of long-term care, because Medicare is not the solution for long-term care. This primarily 20 days and then the 21 through the 100 days, really hard to trigger that benefit. So please don't depend on your Medicare for your long-term care plans. Under your Part B of Medicare, there is an annual deductible of $240, and then it goes to an 80/20. So it looks kind of like your current health insurance plan now. But there's no out-of-pocket maximum. So that 20% can run indefinitely, and that's the difference of what you have now with a health insurance plan where your co-insurance is generally capped so that you don't pay those out-of-pockets indefinitely, where on Medicare, there is no cap on it. So $10,000 bills, $2,000 responsibility of the Medicare beneficiary, not a lot of money. But a $100,000 bill equates to a $20,000 out-of-pocket responsibility for a Medicare beneficiary. So while Medicare is the place to start, there are some holes in it, and that's why we talk about the Medicare health plans. And then we go from Part A of Medicare and B of Medicare to Part D, which is the prescription drug coverage. All plans have what's called a standard benefit design. You generally have a deductible, you have an initial coverage, there can be a coverage gap in certain areas, and then there's catastrophic coverage. What's nice is for this year, due to some legislation that was passed, they have lowered the out-of-pocket maximum on what folks are responsible for on their Part D of drug coverage. It's substantially less than it was in the past. Nice savings tool for folks who have Part D coverage. Now, just like Part B of Medicare has a income-related monthly adjustment amount, or IRMA as it's known, so does your Part D. So if you are in one of those higher income brackets, in addition to paying that IRMA amount on your Part B, you also will pay it on your Part D. So again, a good reason to sit down with your agent so that they can go through these with you so that you know exactly where you stand and what you're going to pay if you fall outside of the standard premium amounts for Medicare Part B and D. Your prescription drug enrollment periods look a lot like your Part B enrollment. You have that initial enrollment period, which is 3 months before the month of your birthday and 3 months after your 65th birthday. They do also have SEPs that you can trigger in the event you weren't able to enroll during your initial election period. And then the annual enrollment period is a chance for you every year to review that coverage, make adjustments if needed, and get the best plan to fit your needs. So we're in that period right now. It started on October 15th. Those decisions have to be made by December 7th, and then that plan choice is locked in for the following plan year. Part D, just like Part B, does have a late enrollment penalty. So if you didn't have credible coverage, or you didn't get in during your enrollment periods and did not qualify for an SEP, you will trigger a late enrollment penalty. It is 1% of the national base beneficiary premium, which in 2024 was $34.70. So that equates to $3.47 a month. Again, it doesn't seem like a lot of money, but that penalty is for the entire time that you are on Medicare. So over the years, it really adds up. That's why we encourage you to get out in front of this and meet with your agents to keep from incurring any of those penalties. And that adjustment does go up, so it will be a little higher for 2025. Just a quick overview of what the Part D programs look like for folks. If your plan has a deductible, you pay the first 100% of the cost of the drugs, and then you move into the initial coverage phase where it's 25%, The coverage gap, again, is at 25% and then zero once you hit the catastrophic piece of your drug plan. Now, this is the standard plan that CMS and the government says that, hey, as a Part D plan sponsor, your plan has to meet these minimum requirements. Most plans are built differently. They're better than this. So when you sit down and take a look at how your drugs are covered, you'll find you'll have better coverage with these Part D plans than what's they offer as the standard minimum coverage. A lot of the plans, don't have that deductible, so you don't have those first dollar costs. So there are changes coming to Part D of Medicare. I would imagine if you are on Medicare and on this meeting, you've already received your annual notice of coverage from your current provider, talking about some of these. And the annual out-of-pocket spending limit is reduced to $2,000 in 2025. In 2024, as we stand currently, some plans had as much as an $8,000 out-of-pocket limit. 2025, they've capped that for all beneficiaries to a spending limit of $2,000, no matter which Part D program they're enrolled in. So nice benefit, nice change for folks to help save some money. So as you can see, the standard model changed based on that threshold for 2025 with the deductible and then the initial coverage phase of being 25%. So again, most Part D plans that we look at are far better than this. This is the standard model. One of the things that is a big change for 2025 is they are able to now what they call smoothing of payments, and it allows Medicare beneficiaries who use expensive drugs not to get hit with that first $2,000 right out of the gate. They're allowing the carriers to essentially spread those payments over the entire plan year for their Medicare beneficiaries. So if someone in this example were to go in January and they incurred $4 worth of cost, the enrollee would only pay the $4. But then in February, they filled a drug or drugs that have an out-of-pocket cost of the $1,996. They don't have to pay that all up front. The pharmacy is going to give them their drugs, then they're going to go back, and then the carrier is going to that they have their Part D program with is going to send them a monthly bill of $181.45 throughout the year to get to that $2,000 to help spread that cost, initial cost over the entire year. As we know, folks are on a fixed income. With inflation, things are expensive, money's gotten tight. I really like this plan change for folks. Everyone's eligible for it. There's no qualification. If you're a Medicare beneficiary and you're enrolled in Part D, you are eligible for this program of spreading those payments out. So filling the gaps with Medicare supplements. Sorry, I just had someone knock on my door. Should have put a sign out there. So when we look at the ways that we talk about covering those deductibles and those out-of-pockets that come with Medicare Part A and Part B, there are a couple different ways you can do it. The traditional way is you enroll in your Part A and your Part B, and then you buy what's called a Medicare supplement, and the supplement supplements those gaps in Medicare so that you don't have to pay them. Instead, you pay a monthly premium to the insurance carrier, and then you have to add a Part D plan to get your drug coverage. The second option is what's called a Medicare cost plan. You stay enrolled in your Part A, and then the cost plan assumes all of your Part B expenses, and then you make co-payments and co-insurance based on their schedule versus the straight 80-20 that Medicare offers. With that program, you do have to add a Part D policy as well to cover your drugs. The third option is what's called Medicare Advantage or Part C of Medicare. So we have A, which is your hospital policy, B, which is your medical policy, D is your drugs, and the one we didn't talk about yet was Medicare Part C, and that is Medicare Advantage. And when you enroll in a Medicare Advantage plan, you move out of A and B, and your plan becomes all encompassing in a Part C program that includes your drug coverage. So Medicare Advantage, Medicare Cost Plan, and Medicare Supplement are all ways that you can cover your Medicare. At Farmers Union Insurance, we have the ability to work with you on all of these programs to make sure that you have a plan that fits your needs the best. To get a Medicare supplement, you must have your A and B of Medicare. You must reside in the state or county that plan is offered, and you have to purchase your drug coverage separately. These plans can be underwritten if you do purchase them during your initial election period or you qualify for a special election period. There is no underwriting. They have to take you, and you are covered. And then you add your Part D program. And the premiums with Medicare Supplement aren't one size fits all. Medicare Supplement premiums are based on age, gender, tobacco use. There are some health questions, and then there are some household discounts available. So there are some pricing options that are different based on your situation when we talk about traditional Medicare and a Medicare Supplement. All Medicare Supplement plans do have to look alike, so it doesn't matter which company you purchase it from. It has to be one of these standardized programs, lettered A through N. The most popular plan is the G program. As you can see, it covers all the gaps in Medicare outside of the Part B deductible, which is the lowest out-of-pocket cost that a Medicare beneficiary would be responsible for. So that makes the G a really popular option. And based on pricing, we don't see much activity on the other Medicare supplement programs, because when you look at the premium of a G plan versus, say, a D plan or a C plan example, there's not that much more premium cost to the Medicare beneficiary to pick up all those additional coverages. So when you sit down with your agents, a lot of times those are the programs they look at. We do have pricing on all of them, and you have the chance to look at everything, and again, make sure you find out which is the best plan for you. Medicare Advantage, or the Part C of Medicare, must have A and B, just like traditional Medicare with the supplement. You must live in the plan service area. But here's where we start to see some differences is with underwriting, there is no health questions. Anybody that wants to enroll in a Medicare Advantage plan, no matter their age or their health, they're guaranteed issue, they're eligible to get it. And the premiums, it's a one rate for everyone. So there is no, premiums aren't based on how old you are, gender, or any tobacco use. It's a one rate for everybody, nice and simple. And you do continue paying your Medicare Part B premiums just like you do with the Medicare supplement programs. With Medicare Advantage, they are structured using networks and co-pays and co-insurances based on the plan design. They do have an out-of-pocket maximum, unlike traditional Medicare, which we touched on earlier, that will allow you to, you would pay indefinitely, where with a Medicare Advantage program, just like your current health insurance plan, they cap your out-of-pocket maximum on what you would spend. They also include additional benefits beyond traditional Medicare, and those are items that your agent can discuss with you. The Medicare cost plan kind of falls in between where Medicare Advantage and traditional Medicare and Medicare supplement reside. In order to get the cost plan, you must have A and B of Medicare. Again, you must reside in the service area where the plans are offered. There is underwriting, but it is one question. Do you have end-stage renal disease? If you can answer that, no. It is guaranteed issue at that point for anybody who wants to enroll in a cost plan. They do have one premium for everybody. There is no age, gender, or tobacco rates built in. So again, kind of simplifying that rate shopping process with these plans by having a single rate, regardless of how old you are, your gender, or if you happen to use tobacco or not. Cost plans look kind of similar to an Advantage plan in that they have networks and a co-payment and co-insurance structured based on what the plan offers. They do have the out-of-pocket maximum protection, just like the Advantage plans have. And like Advantage plans, they do have additional benefits that aren't offered through traditional Medicare or a supplement, and your agent can go over those with you. I know that is a lot of information in a short period of time. Folks are busy, and so I don't like to get long-winded on this stuff. I encourage you, as you talk to your agent, they take you through the process, go through all of this with you, make sure again that it drills down to finding the plan that it best fits your needs and works for you. So with that, I'd like to open it up to questions.
Thanks, Lance. One question that I have is, what if my current plan restricts me from seeing my current doctor or my preferred pharmacy? What can I do?
That's a great question, and I think it's a frequent question as we've seen changes coming for plan year 2025 that the major hospital systems in North Dakota have said they are not taking certain carriers' Advantage plans. And if you are on one of those plans and you want to stay on that for plan year 2025, you will have to change doctors because you will not have coverage at those facilities. So they're going to force you to go doctor shopping. How you can avoid that is there are still plans out there that these facilities take, and they have contracts with them. They are network facilities. We offer those programs, so this is the annual enrollment period. It's your chance to make sure that the plan that you have allows you to see the doctors you want to see. It allows you to go to the pharmacy that you want to use. And right now, up until December 7th, you can elect a plan that will fill those needs for you.
Okay, thanks, Lance. Just want to remind anybody that you can either type your questions into the chat or the Q&A, or I did unmute everybody. So if you prefer to ask Lance directly, I did unmute everybody. One question that also came in, do you have to get coverage D?
You do not have to take coverage Part D. If you don't have something like veterans benefits, you will incur that Part D penalty. But a lot of folks that are veterans that get their drugs through the VA generally don't take a Part D program. And we have some really nice Medicare health plans that work alongside that situation. So you don't have to take a Part D. If you don't have credible coverage, though, that will give you an exception. You will incur that Part D penalty. And with Part D, so let's say you turn 65 and you go, hey, I don't have any credible coverage, but I don't take any drugs. I don't want to spend the money. I'm willing to pay the penalty. At age 70, all of a sudden the doctor's like, hey, you need to start taking some medications. That annual enrollment period of the year that you're 70, you can enroll in a Part D program. At that point, you will just pay a penalty on top of your premium for the Part D.
Thanks, Lance. Another question that came in, Medicare premiums based on yearly income. My spouse is retired and collecting Social Security. What is included in determining your yearly income? Is that Social Security, 401, distributions? What does that all entail?
So when you do your taxes and your accountant comes back with your adjusted gross income, the amount that you pay taxes on when they take all of your income sources in, then they take all of your deductions off of there. There is some exempt income from that calculation, but for the most part, the easiest way to look at it is whatever your adjusted gross income. is what they look at for determining that IRMA penalty.
Lance, another one. How do I leave my current Medicare health plan if I'm not happy with it? Do I have to wait until the enrollment period's open?
So if you have a traditional Medicare supplement, those are continuous enrollment. If you have a Medicare supplement with a company and you're not happy with it for whatever reason, we can go out to the open market and find you a Medicare supplement with another carrier, and we can make that move anytime during the calendar year. If you are enrolled in a Medicare Advantage plan, you are locked in for the plan year that you elected, and your opportunity to make a change to that program is during the annual enrollment period, starting October 15th and running through December 7th of each year, giving you a January 1st start date. So even though you would look at doing the paperwork in October or November or up until that December 15th start date, your effective date for the new plan starts January 1st.
Um, Again, if anybody has any questions, feel free to type them or ask them out loud. I do have one last question for you, Lance. If I didn't enroll in Medicare when I turned 65 because I was still working, can I enroll now?
Yes, if you were working and had credible coverage at the time you were first eligible for Medicare, and you were leaving that employer plan, that does trigger your eligibility to enroll in Part B penalty free. If that plan was not credible coverage, you still get your election period to move off of your employer plan if you're leaving it onto a Medicare and a Medicare health plan, but you would pay a Part B penalty and Part D penalty.
Okay. Well, thanks, Lance. I do not see any more questions coming in. Lance, is it all right to share this presentation out with people who are on this call if they wanted to look at it a little bit more in depth?
Absolutely. And I will tell you back to that question about leaving your employer plan. Your employer has to provide notice whether your plan is credible or not. So most folks know, where they're at with that. But again, if you're not sure, I would say of anything you take away from a presentation like this, whether it's myself or some other speaker, is Medicare is complicated. It gets more complicated every year, and it's really hard in these short sessions to really grasp it in its entirety. I just cannot stress enough the value that you have with your local farmers union agent, that you can sit down and they can take you through this stuff from A to Z and make sure that where you at with your Part B premiums, your Part D premiums, do you fall in that IRMA piece? Which of the three options, the traditional route of Medicare, A and B, and then adding a supplement and a drug plan? Is it a cost plan if it's available in your area? Is it an advantage plan if it's available in your area? They can take you through all the steps, show you all the options, and make sure that when you sign up for the plan, it's the right plan for you that allows you to see the doctors you want to see, the pharmacists you want to use, and the coverage that works for you at a price that you can afford.
Well, thank you, Lance, for taking the time. Again, remember the deadline to enroll for Medicare is December 7th. If you have any questions, please feel free to reach out to Lance or your local Farmers Union insurance agent. As mentioned at the beginning, this webinar is recorded and will be on the North Dakota YouTube channel if you'd like to rewatch it or share with others that you think that might be interested. And also be on the lookout for any future webinars that NDFU will be hosting. We will be starting our regular webinar series again coming January 15th. Those will be held the third Wednesday of every month at 10 a.m. with different topics and experts such as Lance. So with that, thank you everybody and have a good day. Bye.
Thank you.